So Tony Thomas and some other clinical leads and clinical coordinators got together, and they implemented on HealthStream, implemented some competencies for each year to go over that to try to help the nurses feel more comfortable. Weight monitoring, once again, we're still not 100% on doing the weights daily. We're still not 100% if we do them, that they're being done accurately. Sheila and I will watch that in the chart, and as we monitor it, if we see that the weights don't look, like if someone, the next day they weigh 5 more pounds than they did before, we certainly get on the phone right away and call someone, let them know that the weight has gone up, what's happening. We don't see any documenting, going on with this as far as nurse or doctor. Education of respiratory patients. Rich Jackson and his crew have started a pilot program as well on 2 South and 3 North for the MDI and DPI education to the patients on how to use their equipment and how to clean it and things like that. And so I wish Rich was here so we could get a little update on that. 123 CHF was started October 1st. This is a program over in the Foundation Clinic. This is to help the clinic patients monitor their heart failure more aggressively. with having done all of that, one day Vanessa took her to one of her meetings, and took her to one of her appointments, got her identification at DMV that day, went down and applied for disability. Long story short, that day she was able to take her out for sugar-free yogurt. And you would have thought, Vanessa said you would have thought she handed her $1 million. She started to smile, she started to cry, she was just so happy to have gotten that little tub of ice cream. And good news, good news, she is now in an adult home in Chesapeake, and I called in January to see how she's doing, and she's only been readmitted one time since April of last year. And it wasn't our hospital.
For heart failure.
For heart failure. It was diabetes.
Okay.
Sheila's got a case study.
So that was a great one. That was one where, we did everything we could do. We all pulled together, which is great. We can always learn from great ones. But we also have some that, people learn from that probably. So we've got a Mrs. Smith, 64-year-old. She was admitted with respiratory distress, cardiac arrest, and flash pulmonary edema. She was combative and not allowing the CPAP. She went into SBT, arrested with PEA, all this prior to the ED. CPR was in progress when she arrived. She has a history of heart failure, breast cancer with chemo, radiation, coronary artery disease, hypertension. She has allergies to ACE and beta blockers, both which require intubation. Here at Maryview, she was here for 23 days. During this stay, it was very complicated. She received 2 drug-eluting steps. EF was noted to be about 40, and family members were frequently at the bedside. Good news is, after great care here, Ms. Smith was back to her normal state of being, but of course she was weak and unable to care for herself due to her ADLs. Families had no complaints at this time and were already being followed by Tony Barks, just as a reassurance because they had had an issue in the past. So PT came and visited the patient, and the eval stated, discuss use of ventilator on discharge to compensate for decreased activity tolerance, endurance, and occasional furniture cruising as she fatigues. PT also documented subjective data that I could use a place to sit when I get too tired, and of course that's from the patient. While here, the patient used the bedside commode because she was unable to get up and down off the regular commode. The doctor had ordered home health, and at discharge time, the family was notified. Daughter stated that she was unable to get here for a couple of hours, but we needed the bed. We needed to get things going. Patient discharge information was reviewed with her in the room. She signed, her IVs were taken out, patient was dressed, sitting in the wheelchair, waiting family to arrive. Family arrived 2 to 3 hours later. Patient was wheeled down to the main entrance with her belongings and kind of sent on her way. So, during a routine post-discharge follow-up call with Ms. Smith, I asked that I speak with her daughter. She had asked me to speak with her daughter, and her daughter expressed all of her unhappiness with the discharge process. So, looking at it, what happened? Well, there was no freedom of choice given, no home health, no walker, no commode chair. The patient had complained of her bottom being We actually called, there's a new program coming out where home health, well, it's not home health, but it's associated with Maryview, where we'll do one free visit. So we got on the phone with them right away and asked if there any way we could take advantage of this to help our patient. They were great, ran out, went to see her. She was able to, she got her walker, she was able to make her doctor appointment the next day. And at the doctor's appointment, I had called and spoke to the nurse navigator there, and this is where the nurse navigators really play a great role, because we were able to continue her care and make sure that she didn't get anything left behind. Talking to the nurse navigator then made sure that when she came in that they had that commode chair there waiting for her so that she could take it home and have something that day and wasn't left at it. So the biggest thing I just want to say about this is that, we talk about teamwork and we talk about everybody coming together. Everybody, just please remember that, if we make a mistake, we're human. It's okay. And, we need to learn from it. And, if we're working together as a team, we're here to build each other up and to help each other and realize that everybody wants what's best for the patient. Just sometimes things slip. With Lynn and I being the navigators, the one thing that patients always tell us is that we're like their family. Reason being, all of you in the medical field, anybody gets sick in your family, first thing they do is call you, want to talk to you about it. If you're in any type of business, people tend to do that. And what we do is we do that for our patients, navigating them through the system and making sure. You think we got time for one more? You want to?
Yes, sir.
All right.
The other case study I have, where is it? She was 54 years old, history of high blood pressure, COPD, hypothyroidism, chronic anemia, and renal insufficiency stage 3. Now she's new onset systolic heart failure, and they couldn't quite figure out what was going on with her until they did finally see a left atrial myoma that was there that was causing her to go into heart failure. So after they did the surgery on her, this was beautiful textbook. She got all of her education. I could see it in the education tab that every day someone was going in there and teaching her about heart failure. Every day someone was weighing her correctly. Every day she was getting the 4 medications and so forth that she needed to get. When she went home, the secretary had, within 7 to 10 days, she had a PCP, a cardiology, and a surgeon visit, all within 7 to 10 days. Care management was able to get home health care with telehealth for her. And when the heart failure navigator called her, she could regurgitate all the stuff that she learned in the hospital. So it's, you might hear a lot of times that hospitals are not really the prime time to educate patients. Well, sometimes it isn't, sometimes it is. And in this case, she was ready to listen. She heard everything, and I hardly had to ask anything. She just told me exactly what she was doing. It was beautiful.
Well, talking about some of our programs at Bonsecours, we've already mentioned the telemonitoring. Bonsecours Home Health, we kind of mentioned that hospital to home, that one visit. But Bonsecours Home Health actually has a lot of great programs. They actually, when we make sure that we get those orders, of course they're allowed freedom of choice to pick whoever they like, but I'm partial to Bonsecours, of course. We have a great program. What they do is they actually go in the home and will take the medications out of the patient's cabinet and sit down with them and put the ones they're not supposed to be taking in a red bag and the ones that they do take in a green bag. And anything that they need to ask their doctor about or anything like that goes in a red bag sealed in the purse or by the door for them to take to their doctor's appointment, which is really great that they were able to do that and spend that time with our patients. Cardiac rehab, I just wanted to mention them. They're trying to achieve coverage for our heart failure patients, and we should know something in March about them being able to do that. Lynn and I are also working with them. We're going to try to start getting some inpatient education done as well. like Lynn said earlier, we're going to start offering classes for the patient and anyone interested in heart failure. And also remember that we have resources here for our heart failure patients. So if you go in and you tell them that they need to weigh and they can't, there's barriers, can't afford the scales, blood pressure cuff. Actually, Lynn and I have everything we need now. And we got that actually through a donation from being a team player. We volunteered to work the 1-2-3 CHF program after hours and before hours and on weekends. Helped them build it, but we did. And doing that, they awarded us a grant for our patients here in the hospital. And they gave us scales, blood pressure cuffs, pedometers, 6-minute walking sticks for us to map out to meet joint commission requirements for the feet that our patients are walking. And we have cookbooks. We have a lot of great resources. So please don't, feel free to call us. Let us know. So takeaway message for this is you have to enable and empower people to make decisions independent of you. As I've learned, each person on a team is an extension of your leadership. If they feel empowered by you, then they will magnify your power to lead. And that's by Tom Rich. The other takeaway message is to respect all disciplines, and all disciplines will respect you. Remember, we're a team working together for our patients. And just a special thanks here to some people who have really stepped up and helped us along our way to achieve those accomplishments. We can't wait to see what exciting ideas you guys develop in the future. Okay. Oh yeah, so for the heart failure education, we have folders over here, and we have several on everyone's floor. But if you don't, please feel free to take them. And if you run out, please feel free to call us and we'll replenish them. And if you feel like your staff needs anything, just let us know, okay? And if you have any questions.
Every patient that comes in with a primary diagnosis of heart failure should be receiving one of these education folders.
So that's not including the history of, you know?
It doesn't hurt to give it to them as
Yeah.
well, but if they're here with a
The history
primary,
of, yeah.
please at least make sure that the primary get one. But yeah, if it was me taking care of a history of, I would give them one.
Okay? Thanks, y'all.
Oh,
We just want to
pictures.
thank